So Marginalized Kenya has partners with Mombasa County in various areas. Number one, we support the county government in capacity building the CHVs and also the community health strategy docket. We also partner with them on matters to do with service provision, where the PSS sector has done a lot in terms of capacity building of the service providers, and also on advocacy on matters to do with safe abortion care and post-abortion care services.
Okay, Mombasa as a county has been playing several roles in sexual reproductive health information. Marginalized as a partner has been supporting both the private and public facilities within the county, and then we have the public sector strengthening the PSS program within Marginalized that is happening across the county within some of our facilities, which are Marginalized supported facilities. We call them the PSS staffs who are working in these clinics. They have been trained, and we have had the issue of quality improvement in our facilities. They ensure that the staff has the right documents, because that is part of the quality.
Marginalized have supported the Ministry of Health in the development of training packages for healthcare providers in terms of provision of family planning, PAC services. Most of the time they have even taken half of the counties, 25 counties out of 47, for them to be able to support those counties in the matter of technical assistance. Marginalized have also supported the ministry to be able to roll out these packages in the county, and Marginalized supports the development of even the reproductive health policy for it to be able to govern the country.
So one of the ways that Marginalized continues to collaborate is ensuring that we are working very closely with like-minded partners. And how we do this is, for example, we are participants of the Technical Working Group for Sexual and Reproductive Health, working very closely with the government, Ministry of Health, the county and sub-county government, to just be able to, one, share especially our data, so that they can be able to see the contribution that Marginalized is having in provision of SRH services in the country.
So basically, the role of demand creation under Marginalized Kenya is to ensure that there is awareness within the community. It is aligned under community health strategy. At the top management, we have the community health strategy focal person, who is then followed closely with the sub-county community health strategy person. Underneath, we have the community health extension workers, and then we have the CHVs, who are now the ones who work very closely in ensuring that awareness is created in the community.
For our public sectors, each and every month through Marginalized, the facilities that they support, that facility has every month an allocation for either an enrich or an outreach program. For example, we usually have camps for Marginalized in provision of long-term methods. It helps us to reach out to our mothers who really need these services, and most likely they could not have afforded the service, but they come really in handy. It has supported in a way that even the quality aspect within the county department has really improved. When the county is planning the sexual reproductive health activities, they usually come with their budget so that they can match together with the county allocation and at least plan.
So our main target was to ensure the adolescents receive the services. And when I talk about adolescent, I talk about 15 to 19 years. The way the strategies for us to reach the adolescents, it's a bit different with the married clients, because this one for adolescent is more on ensuring they complete their education. The second people we were targeting was anyone who earns less than $1.9 a day, because it means most of the time they don't have the insurance cover. So we are talking to them, giving them the sexual reproductive health services for them to have a good life, so that they can have few children and only have children when they have a choice. And that's why we spread our wings and also put in activities which will ensure the adolescent services are provided.
With the support of Marginalized, we have been able to achieve infrastructure across the country in terms of park services, something that never used to happen. Maristops have supported the ministry to achieve park rooms, instruments, capacity building of the healthcare providers, so that now when you you walk in a health facility and you need park services, you will be provided for.
Maristops Kenya has also procured some instruments that we use in our family planning rooms across the county. Through the county, Maristops was able to provide the consent forms to our facilities, whereby the facilities are using them so that the patients can consent for the procedures, and in case of anything, you see that our healthcare providers are covered.
Wakati niliamua kupanga uzazi, nilipatana na mama ambao alinihamasisha kuhusu Maristop na wakanipeleka hadi vituo vya Maristop, na nikaweza kupatana na madaktari ambao walinihamasisha kuhusu kupanga uzazi. Walinieleza aina za kupanga uzazi, na mojawapo ambao niliona ni sahihi kwangu mimi, niliona coil. Ni affect, iliendana sawa na mwili wangu.
The issue with the quality assurance, Mombasa County has been able to at least achieve an award for the best health service. This one we can say Maristops has also played a big role for its continuous support on ensuring that we have quality service within the county.
So as Maristops Kenya, our focus will be on ensuring that we offer choice. And choice to us is ensuring that every client that walks into our facility, number one, is given a client-centered care, which is very quality service, but also is given a contraceptive of choice to them, not what is just available. We want every child that comes forth to be a wanted child.
As Ministry of Health, we are privileged and glad that we have partnered with Maristops in the provision of family planning and park services.
Let them feel that they are really needed in Mombasa, despite all the challenges, but we can still work together and gain more.